Yeah, I did that. Okay, yeah. But I'll first start by acknowledging all the young pharmacists or medics or just everyone in this room who wants to move into regulatory affairs. I'll tell you a tiny little quick story about myself. So you're right, when I left farm school, I did not know there's anything like regulatory affairs. Like, you absolutely did not know anything about regulatory affairs. We knew we were going to work in hospital, we knew we were going to work in industry, we knew we were going to work in the community, and we did. We went into hospital. Fortunately at that time, we were being posted. I say fortunately because I realize it's a privilege right now that we were posted. And after internship, we were also posted into hospitals. Then one day, I think I had come to, I was working in Mombasa, Coast General, and I decided, okay, I want to do a master's in tropical and infectious diseases. They say I don't use that master's, and I tell people. I was like, I want to go and work in an NGO, so I saw the nice jobs there, and I was like, yes, I'm going to do this. So I took myself home and I said, hey, yeah, this is what I want to do. They're like, really? I'm like, yes, this is exactly what I want to do. And then I went Unity, University of Nairobi, Tropical and Infectious Diseases. We were 8 people, a very small class, very high-level lecturers. You know those lecturers who just do research in Kenyatta Hospital. I reached there and said, well, okay, let me just do it because I'm not a quitter. Let me just do it. So, then I went back, I worked in hospital. That was 1.5 years of my life. I went back to hospital, I went into MP Shah. Then during one of these gatherings, the way you just go meet all classmates, and then you're like, oh, there's this thing, someone went into regulatory affairs, You're like, what is regulatory affairs? You're lucky that you even have a course that you're doing to even orient you. I was oriented at the gates of PPB. So I decided that I went to talk to the person who makes the rota at Pisha. And then I told them, you work a night. I'm going to do nights, and during the day, I'm going to do regulatory affairs. So I joined Glenmark. They wanted a pharmacist to just set up their scientific office. Just set up. So, John Paul, I'm there with you with time, I did forever. And then I did that for like 3 months, and then I got a permanent job because at that time, all companies now all of a sudden were mandated to have a regulatory affairs pharmacist. It could have been done with someone from outside Kenya, but I think at some point PPB kept on asking who's your responsible pharmacist in their applications. So I got a job, and I can tell you those first 3 months I used to go to PPB, and I used to meet another lady called Jacqueline. She's now my friend. But Jacqueline used to send me back with those documents in a manner that was so humiliating. So I have been somewhere that I don't know. You take the documents and she's like, Fungua, hizo files zako. Kwa nini umekuja na file mingi? You know the way someone just, and then you lined up, we're there behind Dr. Nganga, we are there behind, we're so many. And all of us are opening these files, carrying like 5 files per doctor, because module 1, 2, 3, 4, 5. And then maybe you have 10 products or 5 products, and then you have to go from screening, then you go and pay, then, But I can tell you that for those who have said they have quit their previous job, they're looking for a job in a hurry, it is possible. Those of you who are doing 2 jobs, 3 jobs, I've heard it is possible. All right? So, let me jump from that time to now. Okay? And the topic I've been asked to talk to you today about, very short, how important is self-care? For me, that's how I interpret how important is self-care in pandemic. Who wore a mask? Surely, all of us wore a mask. I'm going to ask this question, and please answer honest. Who drank ginger lemon tea? Right? Who took vitamin C supplements? and see, and even before you were told, you know, you were eating oranges, you were washing your hands 10 times. What else were you doing? Social distancing. All that is self-care, by the way. All that is self-care. Wearing a mask to ensure you prevent yourself and prevent others from getting is self-care. Taking multivitamins to prevent you from getting a bad experience, because we all got that experience. It's just the level of badness or severity, that is. Also, we quickly learned that we can get information on the phone, right? Quickly. Where is the next center for this? Where can I get tested? Where do I report? That's self-care. All that is self-care. Right? Now, there are self-care enablers during the pandemic that I would like to note. First thing was information. You know, the government rarely used to give us information apart for any disease, apart from, I think it was HIV and TB, right? There was a lot of information on HIV. Go get your, can go get tested. Pregnant mothers, please go and get tested. And then TB and TIBA. I remember that from a while back. But then all of a sudden, the government is even posting, go and wash your hands and how to wash your hands. Now that is self-care. How to sneeze. Oh yes, and how to cough. Right? So last time when I was here, we defined self-care. Right? It includes facials. It does. And making your nails. It does. But I will tell you some few enablers of self-care that I feel are important during a pandemic. First things first, stakeholder support. Who are stakeholders in this case? I would say everyone. It would be the policy makers, where like John Paul is working. It would be the patients, consumers, regulators, and everyone else in between. Those are the stakeholders, right? And if we all are on the same boat, then it would be easy. But the situation in Kenya, as of now, is that we may be confusing self-care with self-administration of prescription-only medicine. We may be confusing. We may also have presently patients who misuse products, medicinal products, medical devices, right? The patients who we may also in our midst have medical doctors and pharmacists who prescribe medicine, you know, how they want. So you just a relative of yours calls and says, hey doc, I have this, oh go take azithromycin. And I'm saying that purposefully because all of us took that azithromycin during COVID. And we took it without being tested. And yes, there is those things. But we need to address every stakeholder's concern when it comes to self-care so that we can move it to the next level, right? Now, the other enabler is consumer and patient empowerment. And I feel this is very important because this is where we say how literate are our country people, are we to be able to say, okay, I only have a headache, let me go and take a paracetamol. How literate are we to say, okay, now this headache has lasted, I need to go to hospital. Now, we need to have programs in place, and we saw that during COVID. There was funding for education, how to wash your hands, posters, how to take your medication, how to isolate and everything, and that all falls under patient or consumer empowerment. So self-care needs us to be able to empower our patients. Now, is it the pharmacist who's going to do it? Can we use other media channels? We did see that, right? We saw that at the end of the day, it's not only a voiceover on TV can actually educate us, right? Yes. So that's another enabler of self-care that I feel was used during the pandemic. Self-care health policies. Self-care health policies is the extent to which policymakers recognize and support the economic value of self-care. Now, there was a study that was done, and it did say that self-care has a benefit to the country, an economic benefit. So imagine in a country that you have to go to hospital to get each and every medication. Right? From when you have a stomach ache, to if you hit your toe at the edge of the bed and you feel like it's swollen, to your child is having a fever, right? You had to run to hospital. Now what does that mean? For a mom means you miss work. Probably in Africa, where all moms I feel work, that's a day missed, either going to the shamba or a day missed doing a casual job, or for us who are in the corporate, a day missed doing one or two things that would have helped you reach your target. Right? For men, of course, same thing. Nowadays, I acknowledge that they take children to hospital. You do, right? But it also means that workforce reduces. It also means time at the hospital increases. It also means you have to pay consultation to get a really simple ingredient that can solve your problem. And we did see that in the pandemic, that all of a sudden we could be able to send paracetamol and vitamin C and zinc and what else? Oh, dexamethasone. You haven't sending dexamethasone, okay. All the way to a patient. Now that patient didn't leave their house. They got their medication. And those of us who are working from home, we continued working. Those of you who are going to school, you continued going to school by taking your medication. You didn't have to go take a whole day off. Now there is some economic value to self-care. And we did see that. We saw us taking all the medications the way we are supposed to do. I was appreciating how people were reading patient information leaflets. I appreciated it because I got so many calls on side effects. People who never even used to read about side effects, they read it. And that means patients have increased their literacy levels. One dial, 2 dials, right? So we need, and we saw that, and we need to work on that aspect. And then the regulatory environment. I cannot emphasize what John Paul has said, the regulation environment needs to be able to facilitate self-care. Self-care needs to be in the policies we are seeing in Kenya, for example. They're coming up with a schedule in the KDA. They actually need the KDA to go through so that they can now do the scheduling, right? And then they also need to do maybe registrations of cosmetics. These cosmetics now we use maybe to treat our own acne, other types of cosmetics or borderline products. We're seeing many countries also, when they're moving to ML3, they have to have a switch, what we call a switch regulation. That means products that were previously in prescription-only medication, now because they have been used over time and they have been proven to be safe and they are simple molecules, and we've seen that patients understand how to use it, we can then move it from a prescription-only medicine and down schedule it to a OTC, and also further down schedule it to a general sale product. And I feel that there are many products that are still under prescription-only medicine that at the pandemic we used as OTC or as general sale. And the lessons from there are being implemented, and now we are seeing the fruits in some countries. We are seeing some countries open up and say, okay, we can increase access to this to our patients by making this product available. Now, for example, like Tanzania, they have the duka, the small dukas like ours, kiosks, but they train the person in the duka. So they have the TMDO officers regionally that go in small dukas and train, because now they realize they don't have enough pharmacies around Tanzania, so they have to, their medication needs to reach the people, but now there are no pharmacists everywhere in Tanzania. You get? So this is literacy, this is access, this is creating a policy to enable the people to get what they want, right? And of course we have challenges. We saw challenges. First, misuse. I think second, misuse. Third, misuse. We see challenges in practice that enable then antimicrobial resistance. But at the end of the day, I feel that self-care was important during the pandemic and is still important in preparing ourselves for a pandemic in the future. As my colleague has said, we are a pandemic in waiting, or it's coming. We just need to prepare ourselves better, right? As I finish, I just want to mention that I'm very, very privileged to speak, but a suggestion is that maybe we could have a keynote speaker next time from the regulator. So that, yeah, it would be really, really good to now finally merge and go full circle on this one. So thank you so much, and thank you for listening to me.